Hello and welcome back to Mama Tales, a podcast on our collective motherhood journey. I'm your host, Sally Kuria. Like I mentioned in the last episode, I am introducing a new series in the podcast called Raising Tiny Humans, where we take a closer look at parenting, the society, and the landscape around us, and how it affects how we raise our little ones. To kick off this series, we are diving straight into a topic that has been making headlines and stirring heated discussions amongst parents in Kenya: the controversy surrounding the recent polio vaccine campaign. It's a story that goes just beyond health. It's about trust, fear, and the ongoing tensions many of us has when it comes to government-led initiatives, especially with this specific government. So, what's really happening with the polio vaccine? And why are so many parents choosing not to vaccinate? I don't think I had given vaccines much thought until I had my first child. 6 weeks after giving birth, I would have to go to the clinic to get her vaccinated. In the build-up to this, I had been exposed to different schools of thoughts on vaccines. On one hand, it was a must-do, a necessary part to play to make sure that these nasty diseases do not affect your children. And to this, I agreed. The other side of the conversation came from people who had heard about or experienced the other side of vaccines, the irreversible damage. This side was scary. How would I know that that would not happen to my child? And why was this even in a conversation? Shouldn't vaccines just be safe? Would I be intentionally hurting my child by getting her vaccinated? We did eventually vaccinate our child with no side effects, and by 18 months, I thought I was done with this never-ending turmoil in my head. That was until two people, a man and a woman, covered in a yellow babe and carrying a cooler, knocked on my apartment door one day. They were there to give her a polio vaccine. Polio is a highly infectious viral disease that mainly affects children under the age of 5. It can lead to severe complications such as paralysis or even death. The only way to prevent polio is through vaccination. In Kenya, children receive the polio vaccine at multiple stages: at birth, 6 weeks, 10 weeks, and 14 weeks. This helps build strong immunity earlier on. But sometimes we see additional rounds of vaccination being given beyond the routine schedule. Why? Well, polio remains a global threat, especially in areas with low vaccination coverage. Recently, Kenya reported cases of vaccine-deprived poliovirus type 2, which can emerge in communities where not enough children have been vaccinated. To respond quickly, the Ministry of Health usually launches an emergency vaccination campaign to protect as many children as possible. This campaign involves health workers going door to door, aiming to reach every household. It's a strategy that has proven effective worldwide, especially in countries where access to healthcare facilities is limited. By bringing the vaccine directly to families, the government can quickly address outbreaks and ensure that no child is left vulnerable to this potentially life-threatening disease. But this time round, things did not go as planned. Reports of adverse reactions started surfacing, and soon the trust that many parents once had in these vaccination campaigns began to crumble. So, what happened? And why has this particular polio vaccine drive sparked so much fear and backlash amongst Kenyan parents? Well, that's what we're going to try and unpack in today's episode. When the two health workers came to my apartment door seeking to give the polio vaccine to my daughter, I was hesitant. As a first-time parent, I didn't feel prepared enough to know if this is something I want for my child or not. She had already received polio vaccines, so I didn't understand the need for the supplementary one. There was an outbreak, they said. We are going around neighborhoods giving additional vaccines to children under 5. I hadn't read or seen anything in the news to support this, but to be honest, I was not as clued up to everything at the time, so maybe I just missed it. I stood there contemplating, running the pros and cons in my head. They'd probably done this 1,000 times, I told myself, and I don't want my child to get polio, right? So after a while, I agreed. I went into the house and brought my daughter to them and let them give her the vaccine. It was a few drops, I think. Then they colored her finger with ink and turned to leave. I asked them to wait. Why would they not give me any details about the vaccine they just gave her? In hospital, each vaccine batch number is recorded in my daughter's vaccine card. Why was this one not? They seemed puzzled, but I insisted anyway, asking them to write down the date, any identifying information about the vaccine, and their contact details. I did this because I knew that in some way, I did not trust them. This was in 2021, and that was definitely not the first time they were doing these rounds. Kenya's journey with polio vaccination has been pivotal in the nation's public health landscape. We reported the last case of indigenous wild poliovirus in 1984, marking a significant milestone in disease control. In the early 2000s, Kenya adopted the door-to-door polio vaccination campaigns as part of the global polio eradication initiative. This strategy aimed to reach children in remote and underserved areas, ensuring comprehensive immunization coverage. The approach proved effective in responding to outbreaks and preventing the disease's spread. Initially, these campaigns were met with general acceptance, contributing to a decline in polio cases. However, challenges emerged over time, including vaccine hesitancy, mostly fueled by misinformation and mistrust in government initiatives. Let's just be honest. In Kenya, public trust in government initiatives has been a really complex issue, influenced by various factors over the years. Persistent corruption, to begin with, within government institutions has significantly eroded public confidence. High-level scandals, especially in health, and mismanagement of funds have led to Kenyans really questioning the integrity and the effectiveness of these government programs. For instance, the misappropriation of funds intended for healthcare and infrastructure projects has been a recurring issue, undermining trust in public services. Additionally, the absence of meaningful citizen engagement in decision-making processes has further deepened the trust. We've seen this recently. When policies are formulated without adequate consultation, the public often feels disconnected and skeptical about the government's intentions and the potential benefits of these initiatives. We can also say that limited access to information and lack of transparency in government operations have fueled suspicion. When citizens are not well informed about how decisions are made or how resources are allocated, it becomes challenging to build trust. As parents, we naturally want to protect our children, but in Kenya, we're navigating an added layer of complexity. This long-standing mistrust of government-led initiatives and the dismissal of all our concerns. Many parents over the years have come out to share mild to severe reactions that children have gotten after taking the vaccine. Here's one instance from 6 years ago.
Now allergic reactions from children who got the jab.
And the Ministry of Health just last week completed the fifth round of its door-to-door immunization drive. But some of the parents who NTV spoke to say their children had started developing itchy and painful rashes after the immunization.
Well, so the question now is the vaccine really safe? Well, the Ministry of Health says it's nothing to worry about. But as Eunice Omolo reports, that's little comfort to the parents whose children have now been affected.
Symptoms persisted. She had vomiting, a lot of vomiting, diarrhea, high fevers. She could not breathe at night. She had foam in her mouth.
It is not the first, but the second time 4-year-old Elizabeth Manyata has had this uncomfortable itch. According to her parents and from the hospital documents NTV saw, it first happened in July, just hours after she'd been immunized in a routine polio vaccination drive.
The whole of her life.
Her parents then dismissed it as a mild reaction, and even though their neighbor's 4-year-old daughter displayed the same reaction to the vaccine, Damien Manyata and his wife ensured that their child was immunized yet again during the latest campaign that just ended last week.
I could not risk her life. Once somebody gets polio, that is it.
The uncontrollable itch and the rashes came back soon after, and now her parents are worried sick.
The child was okay before vaccination, and immediately after the vaccination, she started vomiting. There are so many children who are inside that ward, many of them. So the doctor told me, we are aware of these cases. There is a reaction with this polio, so you have to be admitted.
Jane Gishuki, a resident of Kahawa West, also says she noticed scald-like marks on her niece's skin, which upon drying left scars like this. The rashes started forming after being immunized against polio. Dr. Daniel Langat, in charge of disease surveillance and response in the Ministry of Health, has downplayed concerns about the vaccine safety, saying such reactions are quite common and are just mild.
Just like any other medication, whenever you take any medication, including the vaccines, you will have some mild side effects.
Yes, I'm not naive. It's okay to expect some side effects from this vaccine and any other vaccine, as it is medication. But where is the education around this? Every single piece of medication we've taken has clearly outlined some side effects. But for something as big as a nationwide polio campaign, we have very little information, especially accessible to everyone. In October 2024, the Ministry of Health launched a nationwide polio vaccination, targeting over 3.8 million children under the age of 5. The campaign came after the reports of vaccine-deprived poliovirus type 2 cases in high-risk areas, including Kakuma refugee camp and parts of Nairobi. The goal was clear: to protect our children from polio. But soon after the campaign kicked off, stories began circulating. Parents reported the usual adverse reactions in their children. We have high fevers, vomiting, but we even started getting convulsions. Tragically, 2 children reportedly died. And this set off a firestorm of fear and anger amongst the public. This time around, when I saw the message about the healthcare workers coming, I felt a little more confident and asked my nanny to take the kids to get the vaccine. We had done this once before and my daughter did not get any severe reactions. They went to the field where tens of other kids from the estate had gathered as well, took their vaccine, got the ink on their finger and went back home. A couple of days later, I logged onto social media and started seeing the news. Apparently, this vaccine was different. A lot was happening. 2 children had died after getting the vaccine, with 23 reports of severe side effects noted. The Kenya National Vaccine Safety Advisory Committee reviewed all the reports and noted that out of the 23 cases, 16 were non-serious, ranging from an itchy rash, fever, body rashes, abdominal pain, and diarrhea. Of the serious cases, it was reported that the effects were coincidental due to some underlying or emerging health conditions that was totally unrelated to the vaccine. More than 3.6 million children, including mine, were reached in this campaign. So as they say, it was a generally safe campaign. However, we cannot ignore the problem here. Everything has side effects, we agree, but we cannot brush it off. We cannot use that as an excuse or as a reason as to why people died. With the general distrust that exists around this government-led campaign, with the last campaign causing death, don't you think there would be a need to be a little bit more proactive in building trust with Kenyan parents? In my mind, the solution here is transparency. We need to see the research and we need to process the information. We need to have a trusted source where parents can go to, understand the structure of these campaigns, things we need to look out for, risk factors for your children so that you can make an informed decision when taking the vaccine. The government needs to open this up to public participation, involve us in the planning and rollout of these campaigns. They need to set up proper systems to help parents when they face any health issue related to these campaigns. We need to rebuild trust. At the end of the day, we all want what's best for our children. But trust is a two-way street. As parents, we need clear, honest communication from the government. As a society, we need to start rebuilding the bridges that connect us to the institutions designed to serve us. What do you think? How can we, as parents, navigate these challenges while keeping our tiny humans safe? Let me know your thoughts. You can share them on socials, on Spotify, or on YouTube. Next episode, we dive into one of your stories where a mom thought that she had extremely painful periods, only to find out that she was pregnant, but not in the right place. In the meantime, remember to sign up to our newsletter, follow us on Instagram and TikTok at Mama Tales Podcast, And let me know if you have a story to share or a topic you want us to explore on this podcast. Lastly, consider showing your support to this podcast. Every single piece of support goes a long way in helping me keep this beautiful platform going. Right, till next time. Bye.